Hello, this is Leno Sanchez. Um, this is assignment is Take 3, and the informatics technology device that I'm going to be talking about is barcode medication administration. Um, Before the rise of new technology, many medication errors occur um, due to misinterpretation of handwritten prescriptions. Um, since since the barcode medication administration, um, uh, these medication errors have dropped. The way the system works is when the nurse scans the wristband of the patient and on the medication, and the system verifies um, the 6 rise of medication administration, and it will warn the nurse of any information doesn't match. Uh, Patient safety during medication administration is very important in the nursing field. Uh, as nurses, we administer medications many times throughout the day. The nurse needs to be um, focused on what she's doing, don't have any distractions, and have the knowledge of the medication. But most important, she needs to follow the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and right documentation. Um, in addition to the barcode medication administration, computerized provider order entry and the electronic medication administration record had been implemented to promote a more secure uh, medication administration method. But I'm only gonna talk about how the barcode medication administration system uh, prevents medication errors. And the question we need to ask ourselves is that in hospitalized patients, does barcode medication administration compares to non-barcode medication administration records, and does it decrease 25% medication errors in a 6-month period? Barcode medication administration is a great tool to prevent medication administration errors. The significance of the medication administration errors is that adverse medication events affect the patient's well-being and also their families. Although most of the medication errors are minor, some drugs do have the potential to harm the patient. It can cause death, it can put the patient into shock, or cause some trauma. About 1/3 of the medication errors that hurt the patients happen during the nurse administration phase. Cloet in 2015 said that medication errors remain one of the most common causes of unintended harm to patients. They contribute to adverse events that compromise patient safety and result in a large financial burden to the health service. It's important to mention that there are many reasons that medication errors occur. For instance, interruptions, too much work, lack of staff, um, patient acuity, miscalculations, unhealthy work environment, and individual contributory factors. In fact, one of the most common individual contributory factors is when the nurse doesn't adhere to professional and institutional policies or guidelines, in particular when she doesn't follow the 6 rights. I think nurse managers play a crucial role to ensure that nurses follow all these guidelines. And many medication errors are never reported by nurses, and one of the reasons is because they are afraid to being fired or being judged by the nurse manager or even being bullied by other team members. I believe that nurses should be able to report on these medications without the fear of being fired or being bullied by other nurses. This will help to prevent more errors in the future. Um, the when I also believe that when medication errors occur due to negligence, forgetfulness, or lack of attentiveness, um, the nurse should take responsibility for her actions. Um, a study showed that within the barcode medication administration does work, in that it found that within 6 months uh, of the introduction of the medication administration technology in a trauma center, the nurses' contentment was relatively high compared to the use of non-barcode medication administration. Baden 2018 found that the incidence of medication administration errors were reduced by 54% when barcode medication administration technology was implemented in 2 cardiac telemetry units and on a medical surgical unit. The results of this study had different percentages, depends on the unit, but for the most part, when they introduced the barcode medication administration, there was some improvement. Uh, Yet, there are very few studies that show that the barcode medication administrations may actually increase errors or have no significant impact on errors. Okay, I think that is all. Thank you for watching.